The challenges we face across the country for serving the patients in our communities is ensuring that we have the resources available to do so. Part of that is ensuring that we get paid for all the services that we provide. It's a challenge, it's a lot of work. Capta has enabled us to bring in tools and services to a Presbyterian services that was best in class. They provided us capital, they provided us expertise, and we are already seeing improvement beyond what we ever expected. At the onset of our conversations with Capta leadership team in those discussions, I was hesitant because I felt we were already best in class. How could we get better? We are already recognized by HFMA as best in class nationally. They've proven me wrong. They basically, since the inception, a year and a half ago, we've improved our margins by 4%, our net patient revenue. So that's not only a yield improvement, but there's also a reduction in cost to collect. So they certainly proved me wrong, and I'm very happy to say that. Presbyterian's mission is first and foremost. This is what we're focused on. I've mentioned patient access. That is first and foremost as to why we're here. We do not forget that. What the Capta partnership has enabled us as we've continued to improve our rev cycle performance is truly to allow us to invest in other areas that were perhaps we weren't able to yesterday. So having that 4% improvement in our net patient revenue while also reducing the effort and cost to collect has enabled us to invest in other areas that potentially we would not have been able to. Capta has provided additional dollars that we were not receiving as best in class. Those dollars go to the general bucket that supports the overall mission. Yeah, my advice, I think as I reflect back on over the last year and a half with Capta, and I'm in this not just for Presbyterian, but the industry as a whole. And as I think there's others that are in the same boat as we are. What I would encourage leaders as they're considering partnerships like Capta, particularly with Capta, is to understand that it has helped us from a level of arrogance that we had, that we were best in class, that it really, I'd recommend to step back and allow someone to partner with you and show you that there are ways to improve beyond what you expect, and just look at the problem under a different lens, from a different perspective. And again, I'm surprised at the success that we have, and I know others could achieve such. It's opened up those doors across the organization internally to continue to improve, which is what we need to do. Continuous improvement is what we strive for. But ultimately, I just see that we will continue to enhance the partnership and hopefully be able to help others that are in our same place of viability. I mean, healthcare is struggling today, and we all need that little boost in hand sometimes. And I think Capta provides that. We've dabbled in RPA work and bots and automating processes, but there's so much more. Again, we're inundated daily with opportunities for improvement. What Capta leadership team is doing and have done is to actually be that second lens to filter through and evaluate what's real and not. And there's a level of confidence that the typical organization will not have that level of resources. You just do not have the resources to have the expertise that Capta team brings. When I think about our Capta experience, which has been beyond what I expected, if I were to partner with a friend, another CFO at a health system who I'm certain is in the same shoes that I'm in, I would recommend first and foremost just opening the door and starting the conversation. I think that's the number one thing leaders worry about, is bringing in an external party and letting go and admitting that you don't have all the answers. So I think what I can assure you that you'll find with Capta leadership is they're open, they're a true partner, they're at your table with you to make a difference. If I had to say one thing, somehow package it up, it would be let go and try it.